Dr. Tom Bozzuto, thank you so much for coming to the 2019 GOMA Fall Conference.
You're welcome.
You talked about ulcers.
Right.
You hit a lot of wound care stuff. Tell us a little bit about your practice, if you don't mind.
Well, I started doing wound care while I was in Jacksonville in '89. We started the hyperbaric and wound care program there. And I moved to Albany, Georgia in 2005. And we have a large wound care center, and we take care of basically anything that has a break in the skin. The ER will refer us acute wounds. We get people with burns, but we get a lot of referrals from either primary care for diabetic ulcers or the surgeons if they have to do a guillotine amputation, and they see them one time, 1 week follow-up, and then we get them for the wound care after that. A lot of venous ulcers and pressure, so we see the spectrum.
Yeah, there's a full gamut.
Yeah.
For the primary care doctor who's taking care of a wound in their office, what's the amount of time that they should be working with it before they say, maybe I'm not really doing a service? Is there any answer to that question?
Well, for venous ulcers, they typically don't need a lot of debridement. So if you put a good moisture absorbing dressing on there and get them if it's too big to get a dressing in a compression stocking, put them in an Uniboot, which people can get those, or
Sure.
triple layer compression. But if it doesn't close in size, and it doesn't matter how big, just a few millimeters, over a couple of weeks, it's probably good to refer them to wound care.
Okay.
The diabetic ulcers, I think anything that needs more than just a simple curette, debridement or something like that, probably ought to be referred. Pressure ulcers, most of these people are nursing home patients. A lot of primary care docs take care of patients in nursing homes, and so just moisture management with barrier creams and a good absorptive dressing, keeping stool and urine from getting in them is pretty much the thing.
Well, thank you once again for
You're
coming up and
welcome.
talking, sharing your
All right.
knowledge.